At Hawaii Pacific Health, we focus on hiring the best employees to care for our patients. Ongoing education and training is a must, and we're proud to offer the state's most comprehensive simulation training laboratory technology to help our nurses and other clinical staff hone their medical skills.
We absolutely want to ensure that we have the most competent staff to provide care to our patients, and so simulation allows for them to hone their skills, master certain skill sets that we have to wait. Typically we would have to wait for the situation to occur in the clinical environment, and so simulation allows us to recreate situations that might be rare or highly complex that our staff don't get a lot of exposure to.
The beauty of our sim lab is that the technology allows us to simulate real-life medical situations, so our nurses can experience hands-on, real-time training.
Simulation is very important for critical care because of the level of technology that we can now use on patients. There's a steep learning curve, and simulation allows nurses to learn how to use that technology in a controlled environment, how to apply it to selected patients, and how to apply it appropriately, and more importantly, how to use it safely. So providing simulation allows the nurses who are new in the critical care environment to develop a skill set very, very quickly. They can develop skills that might take a nurse prior to simulation, might take them 5 to 10 years to develop.
The more education we provide to the nurses, the safer and the higher quality of care we're delivering to patients. If our nurses are not exposed to situations on a routine basis, simulation helps them to be exposed to those conditions on a routine basis, and via that repetition, the response to dealing with those kinds of patient issues is going to be better.
It allows us to go over and cover a broad range of different types of emergent situations that can occur with the patient, along with the types of medical backgrounds that they might have.
Performing simulation in this kind of environment that's controlled, if they make mistakes, we see those mistakes, we address those mistakes, the student or the learner can see those mistakes, they can practice the skill, and then when they go to take care of a patient in real life in their units, they will not repeat that mistake.
And we can train our staff in their own environment with their own equipment, and it really allows them to use equipment that they may not frequently have an opportunity to use, and we really get to see great benefit from that in terms of their competence and their comfort level.
We're going to be doing a scenario this morning with Noelle. Tracy, I'm going to have you be the primary nurse. Noelle is your patient. She's a 38-week G2P1 who came in contracting this morning. Before we had our high-fidelity simulators, our academy interns would sit and lecture and hear about situations like shoulder dystocia and hear about the steps they were supposed to take in that particular situation. When they're learning with simulation, not only do they get the didactic content in advance of that, but they participate in the scenario. They actually get a sense of what it feels like to move the equipment around, to touch a patient in that fashion. We try to train as much as possible in the actual labor room, so they're actually using the real equipment they'd use in a real emergency, which will make them all that faster when it really happens. Can you continue the suprapubic pressure, Tracy? I think I've got the shoulder. The baby's almost out.
Sorry, a lot of pressure to all that.
Today's simulation was a labor and delivery scenario with a shoulder dystocia, complicated by a full neonatal resuscitation. At this point, we have about between 2 and 4 minutes to make emergency decisions to get the baby delivered. And in many cases, these babies require resuscitation. So you saw our team activate the resus team, get additional hands at the bedside. Once the baby was delivered, they were participating in a neonatal resuscitation, which is something that we train on a routine basis at this facility. It allows them to practice on a neonate, bagging for ventilations, as well as performing chest compressions, and then the mannequins respond to those interventions.
Healthcare, like other industries, is a high-stakes industry. So like aviation and like the military and like the nuclear industry. These are all industries where it's high stakes, there's little room for error, and lives are at stake. And so it really behooves us to practice and simulate when conditions deteriorate quickly, how we would perform in that environment without waiting for the real situation to happen. We feel like we're a center for excellence when it comes to this type of training and the type of training that we provide. We absolutely compete with the best of hospitals across the nation because of this.